Cancer is one of the leading causes of death worldwide. According to the World Health Organization, nearly 10 million people die from cancer every year, and millions more are diagnosed with the disease. What makes cancer especially dangerous is not just its aggressiveness but also how silent it can be in the early stages. Many types of cancer develop slowly and quietly, producing vague symptoms that are easy to dismiss as fatigue, stress, or minor illness. By the time obvious signs appear, the cancer may already have spread, making treatment more complicated. The good news? Early detection saves lives. When cancer is caught in its initial stages, survival rates increase dramatically. That's why understanding the early warning signs is so important. While these symptoms do not automatically mean you have cancer, ignoring them could delay diagnosis and treatment. In this article, we'll explore 8 warning signs that should never be ignored. If you or a loved one experience these symptoms, it's wise to consult a healthcare professional for proper evaluation. Point 1. Unexplained weight loss. Losing weight without trying might sound like a pleasant surprise at first, but it can be one of the earliest warning signs of cancer. Doctors often say that unexplained weight loss of more than 10 pounds in a short period of time should raise concern. Why it happens? Cancer cells use a large amount of the body's energy. Tumors release substances that alter metabolism. Cancers of the stomach, pancreas, esophagus, and lungs are particularly linked to sudden weight loss. What to watch for? Clothes fitting looser without changes in diet or exercise. Loss of appetite or feeling full quickly. Constant fatigue that accompanies weight loss. When to see a doctor. If you lose weight rapidly without any lifestyle changes, especially if combined with other symptoms, schedule a checkup. While conditions like thyroid problems or diabetes can also cause weight changes, cancer should not be ruled out. 2. Persistent fatigue. Everyone feels tired sometimes. But cancer-related fatigue is different. It is chronic, intense, and doesn't get better with rest. It can interfere with daily activities and often signals that something serious is happening inside the body. Why it happens? Cancer consumes nutrients meant for normal cells. The immune system stays in overdrive, draining energy. Some cancers, like leukemia, disrupt blood cell production, causing anemia and fatigue. What to watch for? Extreme exhaustion despite adequate sleep. Difficulty concentrating or completing tasks. Weakness that persists for weeks. When to see a doctor? If fatigue is ongoing, severe, and unrelated to stress, lack of sleep, or lifestyle, consult a doctor. Persistent fatigue is commonly associated with leukemia, colon cancer, or stomach cancer. Point 3. Changes in skin. Your skin is your body's largest organ, and changes in its appearance can reveal underlying health issues, including cancer. While not all skin changes mean cancer, certain warning signs should never be ignored. Warning signs of skin cancer. New moles or changes in existing moles, size, color, shape, or borders. Sores that don't heal. Spots that itch, bleed, or crust. Skin changes linked to other cancers. Darkened skin, hyperpigmentation. Yellowing of the skin and eyes, jaundice, often linked to liver or pancreatic cancer. Redness or itching in specific areas. Unusual hair growth. When to see a doctor? Any new, unusual, or persistent skin changes should be evaluated by a dermatologist. Skin cancer, when caught early, is highly treatable. For persistent pain. Pain is the body's way of signaling that something is wrong. While most pain is due to injury or common conditions like arthritis, persistent or unexplained pain may be a sign of cancer. How pain relates to cancer. Bone pain may indicate bone cancer or cancers that have spread, metastasized. Back pain can be linked to ovarian or colon cancer. Headaches that don't respond to treatment may signal brain tumors. What to watch for? Ongoing pain that doesn't improve with rest or medication. Pain localized in one area without an obvious cause. Pain that worsens over time. When to see a doctor. If you experience unexplained, persistent pain for weeks, seek medical evaluation. Early intervention could rule out or confirm serious conditions. 5. Changes in bowel or bladder habits. Most people occasionally experience digestive changes, but lasting or unusual shifts may be an early cancer symptom. Bowel-related warning signs. Blood in the stool, possible colon or rectal cancer. Persistent constipation or diarrhea. Narrow or ribbon-like stools. Feeling like the bowel doesn't completely empty. Bladder-related warning signs. Blood in the urine. Frequent or urgent urination. Painful urination. Why it matters. Cancers of the colon, bladder, and prostate often present with these symptoms. While infections or dietary issues can cause similar changes, persistent symptoms should not be ignored. 6. Unusual bleeding or discharge. Unexpected bleeding is one of the most alarming cancer warning signs. Depending on the type of cancer, it can manifest in different ways. Examples: coughing up blood, possible lung cancer. Vaginal bleeding between periods or after menopause, possible cervical or endometrial cancer. Rectal bleeding, possible colorectal cancer. Blood in urine, possible bladder or kidney cancer. When to see a doctor. Any unexplained bleeding should be investigated immediately. Even if it turns out to be something minor, ruling out cancer is crucial. 7. Difficulty swallowing or persistent indigestion. Swallowing problems, dysphagia, or constant indigestion may indicate cancers of the esophagus, stomach, or throat. What to watch for. Pain or burning when swallowing. Feeling of food getting stuck in the throat or chest. Persistent heartburn unrelieved by medication. Nausea, vomiting, or bloating after small meals. Why it's serious. Many people dismiss indigestion as acid reflux or stress, but if it persists, it may be an early cancer signal. 8. Lumps or thickened areas. Perhaps the most well-known cancer warning sign is the presence of a lump. While not all lumps are cancerous, they should always be checked by a doctor. Common types of lumps. Breast lumps, possible breast cancer. Testicular lumps, possible testicular cancer. Lymph node swelling, neck, armpit, groin, possible lymphoma or leukemia. What to watch for. Lumps that grow over time. Hard or immovable masses. Lumps accompanied by pain, swelling, or skin changes. When to see a doctor. Self-exams and routine checkups are critical. If you notice a lump that persists beyond a couple of weeks, schedule a medical evaluation. Why people ignore these warning signs. Even when these symptoms appear, many people delay seeing a doctor. Some common reasons include fear of diagnosis, worrying that it might actually be cancer, assuming it's minor, believing it's just stress, diet, or aging, lack of awareness, not knowing these are potential cancer symptoms, busy lifestyles, putting off checkups due to work or family commitments. Unfortunately, ignoring the signs can make treatment harder and reduce survival chances. The importance of early detection. Catching cancer early makes a life-changing difference. Here are some survival statistics. Breast cancer, 5-year survival is 99% if caught early, but only 28% if diagnosed late. Colorectal cancer, 90% survival when detected early, but drops to 14% at advanced stages. Melanoma, nearly 100% survival if diagnosed early, but only 32% if it spreads. This highlights why listening to your body and acting on warning signs is essential. What to do if you notice symptoms. Don't panic, symptoms don't always mean cancer. Keep track. Write down when the symptoms started, how often they occur, and whether they're getting worse. Seek medical advice. Schedule an appointment with your doctor. Request screening tests. Depending on your age and risk factors, screenings like mammograms, colonoscopies, or blood tests may be recommended. Adopt healthy habits. Even before diagnosis, maintaining a balanced diet, regular exercise, and avoiding smoking or excessive drinking can lower cancer risk. Conclusion. Cancer can be a frightening word, but knowledge is power. By paying attention to your body and recognizing the early warning signs, you can dramatically improve your chances of successful treatment. The 8 major warning signs to remember are: unexplained weight loss, persistent fatigue, changes in skin, persistent pain, changes in bowel or bladder habits, unusual bleeding or discharge, difficulty swallowing or persistent indigestion, lumps or thickened areas. Don't ignore these symptoms or assume they'll go away on their own. The earlier cancer is detected, the better the outcome. Your health is worth the checkup.